Great. Hello, everyone. Welcome to this week's session. So it's about population PK and goodness of fit. And first, we'll start with Mary giving us a summary, her take on the material. Then I'll be available for any discussion, question, things that came to your mind while doing this module. So, Mary, are you ready? We'll give you privilege to share your screen. Let me see how this works. Okay, great. Yeah, we see your screen.
Can you see it properly, or you're also viewing the presenter mode?
Yeah, we see your full screen mode, and I can hear you well. Thanks.
Okay, so I'm going to start now. Hello, everyone. Thank you so much for coming to this session. So I'll take you through Module 7 summary, which is on model qualification of population PK modeling. And the learning objectives is to evaluate the variable goodness of fit assessment for structure models and for the variance components of population PK models. And also going to look at how we can apply model qualification techniques using different graphical and numerical software tools. And lastly, we're going to investigate simulation-based model qualification methods, including VPC, which is visual predictive checks. Further to the objectives that we have, we're going to explore what the standard goodness of fit plots are when it comes to pharmacometrics and how we can use them to diagnose model misspecifications. So there are two concepts that are like in questions. One, we have the model evaluation and we have model qualification. So model evaluation is the use of different methods to evaluate how best a model is performed, how best a model performs. Like when you fit a model, there's need for you to evaluate how best that model is performing and how well it's predicting whatever you want it to predict. And you also need to check if the model that you have fitted satisfies model assumptions. So while on the other hand, model qualification is the use of various methods to evaluate model performance for a specific purpose. So these two are different, but for the sake of our discussion today, we'll focus more on goodness of fit plots. We'll use goodness of fit plots as one way of model evaluation. So there's also a need for us to be able to determine if our structure model is a one compartment model or a two compartment model. So we can do that using exploratory data analysis. So there are a couple of definitions that came across during the presentations. So I'll just explain two, which is conditional weighted residuals, which is represented by CWRES. And this is at a population level. And then there are individual weighted results, which are at an individual level. But both of these are expected to be normally distributed with a mean of 0 and variance of 1. So if there's any evidence of trends in these two, that means there's some sort of misspecification in the model. However, sometimes trends can also appear even in the absence of model misspecification, just because the model is highly nonlinear with respect to random effects and also large inter-individual variability, especially when you're using the weighted residual errors. So these two are used to check if there's bias according to time or constant prediction in the model that you're building. Going back to the goodness of fit plots, as I mentioned, they are used to evaluate model assumptions to show if to show the overfitting if it's acceptable, and also to show that your model did not violate any assumption, any model assumptions. So you can plot the goodness of fit by stratifying it by different patient characteristics that you have. You can choose to stratify it maybe by age, by study design, or dose, like study design, which you can look at dose or formulation, and any other important patient characteristics that you have. So this is like one of the examples of the plots that were plotted, and they were comparing DV versus PRED. And these plots, the goodness of fit plots, were plotted using a library called ggsetara. And these are the functions that were used to run the model. So in this figure, on the left, there's one compartment model, and on the right, there's two compartment model. The top plots were plotted on a normal scale, and the plots down here were plotted on a log scale. So the dotted line in the middle is a fitted line that we want to assess if the data that was fitted did not violate any assumptions. So if we look at the first plot, we see that data was deviating away from the fitted line. That's on one compartment model. But if you fit the same data on a two compartment model, the data falls along the fitted line, which is also the same case when we plot the same data on a log scale. We see that here, I don't know if you're able to see my arrow, but we see that here, where there's like where it's shaded a lot, the data has deviated a bit from the fitted line, and it's going down. But if you fit the same data in a two compartment model, the data now falls along the fitted line. So I think this was just to show us how one compartment model has strong bias compared to a two compartment model. And sometimes it's also good to plot to plot goodness of fit plots on like to plot them together for you to be able to make the comparisons easy. So this also is also an example where they were showing how one compartment model is biased than a two compartment model, as you can look at this figure here on the left is being compared to this one. Like here it was diverting away from the fitted line, but here it fall along the line. So this was just to show us how one compartment model is biased than two compartment model. And you can also, there's also a way to check which error model to use. You can have the additive and proportional plots, or you can have additive only plots or proportional plots. So if how they interpret this, hello? Is anyone speaking?
No, keep going. I don't. If anyone has something, please raise your hand. We are about half time, like we allocated 30 minutes, so we are almost half of the time. But yeah, if, we can keep the discussion at the end. Yeah, keep going, Mary. Thanks.
So this plot in these plots, they were using continuous data to check which error model we choose. So if you happen to see any trend in the plots, that means there's some sort of model misspecification. So that is evidence in this additive model, as the data is dispersing away from the fitted line, while on a CWRES versus TAD, the data is diverging towards the fitted line, which just shows like a clearly defined pattern. So from this, I think we can be able to see that it was quite difficult for us to distinguish between the proportional only versus proportion and additive error models. on a goodness of fit plot. However, you can consider to use other aspects of the model. Okay. And it must also be noted, like if you have continuous data, that means you can use scatter plots. But if you have categorical data, you can use box plots. Like in this example, in the top plot, there's healthy volunteers. Their mean was biased down. If you look at the fitted line, which is dashed, which is also the same here. The SAD, their mean is also down. And here we can see that there's a trend. So this was just to tell us of data the model misspecification that had happened. And we're also going to look at visual predictive checks and understand how we can use it and how to interpret. So this is one of the ways of model validation. And validation is the ability of a model to make external predictions. So you can do external predictions and internal predictions. So in terms of internal predictions, I think you can use VPCs and you can use bootstraps. So we'll get more into that as we go on. So VPC is a graphical method that is used in clinical trial simulations to assess the predictive performance of a model. And it compares the simulated data that is generated by a model with observed data from its study. And the VPC provides a visual representation of how well a model predicts the observed data across different time points and across various quantiles of the data distribution. So you choose to have you choose, like you calculate the quantiles based on how you want it. You can have the 50th quantile, 50th quantile, and 90th percentile, and whatnot, depending on however you've chosen to have it. So going through how a VPC works, first of all, the first step is you have the model simulation where you simulate data that is generated from the model that you want to evaluate. So you should have to make sure that the simulated data should mimic the structure of the structure and variability of the observed data that you have. And then you have to group the observed data into intervals based on the characteristics that you have in your data, the patient characteristics. And then you choose the quantiles. You can, for example, you can choose to have the 10th, 50th, and 90th percentiles, depending on how you want it to be. And then you compare the simulated data. You compare the simulated data with the observed data, depending on the quantiles that you established at first. So in terms of interpretation, you can choose to compare, say, the mean and variability and also the overall fitting of your model. So this is just an example of how like a VPC looks like. And lastly, we're going to look at model validation by bootstrapping estimation. So bootstrap is a resampling technique that is used for estimating the sampling distribution of a statistic by repeatedly sampling from the observed data with replacement. So you can choose to sample, say, 1,000 times. Yeah. And also, bootstrap resampling allows you to approximate the sampling distribution of a statistic without making stringent assumption about the underlying population distribution. So one of the advantages is that you may use the entire data set, no need for you to split, and no need for you to do testing. And also the process is relatively simple. But however, one of the disadvantages is that it is computationally intensive, as it can take much time for it to run. So this was just an example of how Bootstrap works. And Bootstrap also check for a model stability. It also helps you to evaluate assumption of the parameter distribution. And in cases where you see a full covariate model approach, Bootstrap runs may facilitate parameter confidence intervals calculation. And you can consider your study design when you're running your Bootstrap and how many data sets you need to sample in your Bootstrap. Thank you. That is all.
Okay, great. Thanks, Mary. So, any questions, comments from the fellows?
Hello?
I see Tessa's hand and Muina and Tessa's go first.
Oh. Hi, everyone, and thank you, Mary, for the talk. That was informative and thrilling session. So I have a question or that needs some clarification, but it's open for everyone who's on call now. So with the VPC plots for model diagnostic, if let's say one is using R, such as the 30 VPC code, will this code generate a plot that individual can easily use to penalize the model if there are some misspecifications such as the structural or residual errors? For example, in Monolix, one will easily spot this by looking at the red shaded areas. So with R, is it possible? Thank you.
Yeah, I can. So there is many styles, I would say, on how to generate VPC plots. One way, as you mentioned, in Monolix, we have, and you can turn it off. Basically, you have a shaded red area once the line is outside of the region, but that's optional. You can still see that like line is outside of the region. You of course you can code whatever you want in R. So, but my advice to you and everyone, free package solutions are good as long as they work, but the minute you Monolix or Phoenix or non-mem, whatever it is, PSN, don't do what you need. For example, Monolix, when you have time varying covariate, it's a regressor. Things get really not possible to do in Monolix out of the box. So what do? You need to be able to read in your simulated data and generate your VPC as you need, depending on your application. You should not be relying on any prepackaged solution. Of course, they are nice to have. Click a button, very good. But these are tend to be quick, not very useful for final reports, regulatory reports, or publication. You still need to regenerate this graph and redo it for a final report or publication-ready graphic. So, see many hands up. Next, I will take Muila's and Ronald's and Susan. So, Muila, go ahead.
All right. Thanks, Mary, for that beautiful presentation. So my question is just on Bootstrap and VPC. Yeah, of course, this is not like your question, and anyone can answer this. So I was wondering, at what point should we like maybe end just on VPC, or like we proceed to do the Bootstrap? Like at what point should we decide just like maybe to end on VPC or we proceed to Bootstrap? Thank you.
Okay, yeah. Let me, please, faculty, if you have comments. So let me share my screen. Okay, let me know if you see my screen. Can
Yes, we can see your screen.
Yes, Samir.
yes? Okay.
I'm really sorry to speak without being chosen. This is Francis. Something that I personally found confusing the first time I had concepts like VPC and Bootstrap is the underlying sampling methodologies. And I think sometimes it becomes very difficult to know what a bootstrap does or what a VPC does if you don't know how the data is generated, and it creates sort of an overlap in the way you think about them. And in a way, I wouldn't be surprised that some of the colleagues who are hearing it maybe for the first time may have the same concern. Because in a way, you're generating data when you do the two processes, but how you're generating the data may not be very apparent on initial hearing of these two terminologies. And I think maybe it might be useful if you maybe start by guiding us on how these two methods work, the principle, before going into the application. Thank you.
Okay, thanks for your comment. And that's the goal of this session, is to clarify. Not everyone is a statistician or say comfortable with these like predictive checks or bootstrap, etc. But first, when we see our screen, so here I wanted to remind you that we shared the guidance. So we want to do a quality and regulatory ready analysis. So we always have in mind the FDA guidance. And we also shared with you a recording by France Montré. Basically, we co-authored, that's one of my highly cited papers, where we co-authored the model evaluation with the ISOP group. So basically here we developed like a framework what to do, and whatever you see in this paper ended up in the guidance. So you will see XWRS, XPRED, etc. So, but back to like question, what is the difference between like a VPC and Bootstrap? So I would say it's completely different purpose in the sense, a visual predictive check, you are simulating from your model. Basically, you fitted a model, and bear in mind, a mixed effect model has multiple level, multiple type of residual that it's more difficult to grasp than a simple linear model. But what we want is to see whether our model simulation correspond with our observation. So that's the first layer of validation or qualification. Can my model reproduce data similar to my observed one? So that's the minimum we require, because in our field, we use simulation extensively. And we want to see whether, first, can we describe the data by simulating from our model? And if not, what do we need to change in the model to better reflect our observation? And one way, because simulation involves many iterations, like you can simulate 1,000 times, you need a way to summarize the simulation. So most of the time we show a median of the simulation and 595 percentile, a range, and says, okay, that's the range of my simulation. Does my observation lie in my range of simulated data or not? So on. So that telling me my model is good enough to simulate from. That's a VPC. The bootstrap, on the other hand, is more testing the stability of the model and giving me precision. So basically what happens is, with the bootstrap, you randomly resample your observed data and you refit your model 1 time, 2 times, 1,000 times. So instead of only one value for your parameter, say if you run your model 1 time, you will get clearance equal 5, standard error equal 2. And bootstrap, and this standard error equal 2 is asymptotic. It is like many assumptions need to be held for it to be true. Bootstrap, you resample your data, you refit your model. Model 1 gave me clearance equal 5.1, 5.2, 4.8, etc. You repeat 1,000 times, and now you have a full distribution for your clearance. And that's what we call the uncertainty and the precision for your parameter. And you can compute a bootstrap-based confidence interval. I invite you to read about the bootstrap in the guidance. When do we need it, when not? The issue with bootstrap is very, very time consuming. But yeah, many times we need full precision. That's the gold standard on determining precision on mixed effects models. So we run it on our final model, especially when there is like labeling decision and high stakes. We need a bootstrap. And of course, some software allow automatic bootstrap stratified or not, whether it's Phoenix or PSN. I'm not sure about Monolix. If not, you can connect Monolix to R, and it's relatively straightforward to code a bootstrap, resample, and refit your Monolix model over and over and construct your confidence interval. So yeah, I invite you to look at the model evaluation paper. And very, very important that people forget is that, as Mary showed in this example, it's very hard to look at one model in isolation. So if you look at one goodness of fit, it's really subjective, basically. Oh, it's good, not good. But then things become much clearer when you compare models. So say, okay, do I see any improvement? Is this model A better than model B? That's how you make your decision. And few software, if I can say, provides this possibility to head-to-head compare. But yeah, we provided all the R code in this paper that is freely downloadable and it's available on GitHub to help people doing this kind of graph. And you will see we provided also code for VPCs. And here what I want to show, we also recommended not only to do like one VPC for one model, again, head-to-head compare multiple model, including PC VPCs and NPD, etc. I'm monitoring the chat. Okay, so if it's still not clear why do we do VPC and why do we do Bootstrap, please ask again. We need to get this right. That's part of every model effort. I would say Bootstrap is really done at the end. VPC can be done frequently. Just as you improve your model, you want to see, do I get my VPC right? Do I need to change something? I know several of you had raised hand. So who's next? Ronald? And we can get back to the same topic. Just I want to make sure we don't, we cover all questions.
Okay, thank you, Mary, for the presentation. I also have some more questions about validation. First of all, to everyone who have the answer for it. So she talked about external and internal validation, but she gave examples for internal validation. Oh, so what are the examples of external validation, and where do we use the external, when and where do we use external validation? Then the second question is, what's the difference between parametric and non-parametric bootstrapping, and where and when do we use such? Then another question, on model structure or structure model, which one is appropriate to use? Because in the paper displayed, I can see iFred and Fred versus prediction. To me, I thought iFred was the best because there's no, for example, if you're on a best model, there is not yet effect of covariance. Maybe in the Fred there would be some misspecification according to the covariance effect. I thought iFred was the ideal. Maybe someone could clarify for me. So those are the three questions.
Okay. If you can type your questions in chat, I'm sure I won't remember all of your questions, but let me take it one at a time. So so here, let me share again. Okay, so basically, so here we provided a table in our paper. So your question about DV or OPS versus IPRED. So that's what to expect and what to do if the graph does not fulfill requirement. Okay, so it was a little bit hard to hear you about covariate, but yeah, each graph has a purpose and points us to potential model deficiency. And we tend to do multiple graphical diagnostic to corroborate the evidence. Okay, we see trend with residual, with spread, IPRED, etc. So that was one of your questions, I believe. One of your questions were about bootstrap. So parametric versus non-parametric. So the parametric one assume a distribution. That's why we call it parametric, meaning, okay, you assume like a normal distribution and you sample from your assumed distribution and you simulate from. But in nonlinear mixed effects, most of the time, we do bootstrap because we don't want to assume a distribution. We don't know what is the appropriate distribution. That's why I don't remember even if I ever use a parametric bootstrap for a nonlinear mixed effects population PKPD model. We always use a non-parametric bootstrap, which is basically you are not assuming a distribution. You just resample your sampling unit. In most cases, in our work is subjects. So you resample your subject and you refit, and then you construct a distribution by resampling. That's why we call it a non-parametric. And of course, we plot the distribution. Sometimes the distribution is not even symmetric, so we show it. It's not appropriate, say, to compute a median and 595 on a bimodal or like a non-asymmetrical distribution. So I'm looking. Did you have other questions? No. Did you type?
Yes, their question was about external validation. When
Oh, yeah.
do we do it?
Yeah. External validation. So basically, sometimes we call it in a VPC and Bootstrap. All this is internal validation because we are not bringing in additional data, new data. So those of you familiar with the machine learning field, we always try to say keep some data aside. And we fit our model on like say 90% of the data, or depend how we split it. And then what we do is we try to predict the data that we didn't use in our modeling. External, that's why we call it external. So it was external to the model we built. And that's like very strong evidence says, okay, can the current model predict data that were never seen before, not used in the model? So it's rare that we do that in pharmacometrics, since we try to use all the data all the time. But many times what happens is sometimes a new trial comes in, and before including it and updating the model, we want to externally check whether the current model can fit and predict this outside data. So, and sometimes it works, say, oh, great, this data is consistent. we can use the model as is, no need for update. Sometimes we use external validation when we bring in, say, pediatric data, etc. But I would say it's rare. One recent example I've used external validation is when that's for the Mircera approval. Basically, we brought in real-world data from a registry, and we use a model to simulate and predict the real-world data. And it worked. So we externally validated the model by bringing outside data and being able to simulate and predict it. So yeah, that's some example of external validation applications. So yeah, well, who's next? I believe, as I remember, we had Susan and Safa, and now I see Sadiq hand up. Susan?
Okay, so I think you've answered one of my questions on external validation, but I want just to be clear. Is it that when you're, for instance, doing a study on POP-PK and you want to create a model, okay, and you decide to confirm or validate your model using, let's say, a group of patients, maybe collect data from a group of patients who are not included in the POP-PK study to begin with, but have the same characteristics. So you take these people, and then you take their data and you use the model on these people, and that is what is called external validation. Am I correct?
Yeah, it's a new data, whether new in the sense you set it aside from the beginning,
Mhm.
or the data that comes in later.
Okay. Okay. So the other question is, we've only talked about visual predictive checks as as a method of checking for goodness of fit, right? But there are other methods. So is it that the visual predictive checks are the best? Uh, so for instance, in our study that we are doing in the is it project that we are doing, it's a drug interaction study. Are still visual predictive checks the best? Because as I've said, I have read that there are other models. Also, what do you do when you notice that there's systematic bias after you've done your visual predictive checks? What what do you do once you realize that? Is there a way of correcting your visual predictive check?
Yeah, great. So the short answer is we look at multiple diagnostics, but yeah, we want to look at VPC, especially if you plan to simulate from your model. So of course, if the VPC is good, the others will be good. But sometimes you can get your, say, your mean right, but your variability wrong. So your median is fine, but you are way too low in between subject variability. But yeah, we need to look at multiple options. So what do you do? So that's what we illustrate in this paper, basically. Let me check the PD part. So yeah, so and that's a NPDE, same as a VPC. It's just normalized. So here you see that this model is misspecified. So you need to fit the models that better reflects the data, which is like center everything. So here we had the PD or a PK. So you need to change your model somehow, whether maybe different compartment number, maybe you need to introduce a nonlinearity in PK, etc. So you need to tweak your model it's the structure of your model need to be modified to accommodate your data. And then you can correct for your VPC. So yeah, that's one I want to show you. So here we show like regular VPC, NPD, and yeah, there is no one size fits all. But you see here that it's a really misspecified bad model. And in the appendix we have the full graphic for all 4 models we tested. Yeah, you see now once we corrected the model, we are good. Like the trend is not, of course, no model is perfect. You see here, like we are in the region, but not in the model, but that's totally fine. But yeah, you need to get your VPC right so you can simulate from your model.
Okay. Thank you.
No problem. Safa?
Hello.
Hello.
Hello. Thanks for the presentation by Mary, and thanks for your insights. So I have some questions actually. So with regard to the VPC, for example, if we are checking like multiple structural models, and I want to see like the difference between these structural models. At what time I can check the VPCs, or at what time like it gives me a reliable evaluation of the structure, or it will be only on the complete or the full model, like including the covariance, including statistical model. Like for example, if I have a structural model with random effects, can I use the VPC to compare between these models? This is one of my questions. There are like two concepts that it's not clear to me, like the shrinkage on random effects. And the other thing, it's also in the recording, it's overfitting. What does it exactly mean? Like the model is overfitting.
Okay. So I can take your first 2 questions. Basically, in today's world, VPC is automatic, very easy to do. So some software like Monolix do it automatically for you. Okay, it's like you run a model, you get a VPC. You don't need to think about it. Now, if you have a super long model, take hours to run an additional half an hour to run your VPC, maybe you don't want, you will deactivate. But yeah, I would, so sometimes not very obvious. Basically, once you get to a stage of model development, okay, you got your structure right. And then, okay, your median is right. And now you are optimizing really on the random effect. So that's where, okay, you want to really compare the VPCs and see, okay, which model is giving me a better representation of my variability. So yeah, definitely you want to evaluate your model to see which one better reflects. So let us say we have one compartment model. You have Ka, clearance, and volume. So so what we are trying to do here, okay, we got our compartment structural model right, but we want to optimize our random effects. Basically, do we need between subject variability on Ka, on clearance, on volume? Do we need correlation between these random effects? So overfitting meaning you you have more parameters than needed to represent the data. So what happens when you overfit? you are more than perfect into fitting your current data because you overfit it. Okay, it's super good. You added more parameter, all works well, but it's overfit because you will fail to predict new data. That's where external validation, especially machine learning technique, because there are some of these models are very easy to overfit. You want to always check, okay, can I predict external data? And when you are in overfit, you won't be able to do that. So we always want some kind of balance between underfitting and overfitting. We want good enough, fit for purpose for our question at hand. So that's what overfitting is. You are using more parameters than needed, or and that we illustrate in our model evaluation paper. We show that by having your omega matrix more complex and it showed full correlation all across the board, it's very subtle. You can, okay, correct and see that, okay, you might think that's a good model, but in reality, no. You are overfitting. And the true model is still better. Did you have other questions, Safa?
So it's about the shrinkage on random effects.
Yes.
So actually, I didn't understand it that well. Like in the like the concept, like when does that happen? Like when like when can I expect like this is happening? This is like this is a shrinkage of random effects.
So how it works in mixed effects model? You have a population parameter and an individual parameter. So shrinkage happen when you have very sparse individual data. Say you have, I don't know, I have a model with 10 parameter, but then you only have 2 points by subject. So you will be able to maybe determine some of these parameters with more like reliability, but the shrinkage mean you don't have enough information at the individual level. So your parameter estimate will shrink, go closer to your average population value. So shrink is saying, okay, whatever individual parameter value you have are shrunk towards the population median. So yeah, they don't believe or don't pay too much attention on these figures. These are shrunk estimate. So it gives you a pointer. So it's not like you can, well, sometimes when you change the model, shrinkage can change a little bit, meaning, okay, you simplified your model, so your parameters are less shrunk, but really it is your data already collected. You can do much. If you run a phase 3 trial with one data point by subject, single draft design, well, too bad. You can't do anything with that kind of data. Who else? I see Sadiq's hand is up. I don't know if Cassius and Willa have other questions. I see your hand is still up, but let us take Sadiq.
Yeah, thank you, Mary, for the presentation and Samir for the clarification. I have two questions. I think the first one was regarding the bootstrap and VPC, which was nicely answered. My second question is regarding the model evaluation and model validation, where we use goodness of fit as well as the VPC. And I see Colin has commented on my question. Like my question is, where when do we actually say, for example, a model is good or bad? Like we are just depending on goodness of fit or just visual observation for goodness of fit and VPC. So is there any objective measures where we can actually, which we can use to say this model is good and this model is not good? For example, in the slide that Mary was discussing in the first part of the presentation, where the data was fitted to one compartment and two compartments. One compartment wasn't good, but for two compartment, it was said is good, but looking at the predicted line in the first part of the, during early phase of the time, the predicted line is a bit deviated from the fitted line. So actually, can we say, like, for example, two compartment is fitting well? What evidence do we have for that one? And if it doesn't fit, actually, Susan has partially mentioned it. What measures should we take? Like, should we directly go to the structural model, or do we need to consider the residual models or covariate model? Which one should we actually start with first? And I completely agree with what Colin has mentioned. It should be based on the purpose that we are addressing. Yeah, I agree with that point, but generally, I have those questions that I raised earlier. If someone has any comment on that, thank you.
So, like a quick answer, I would say most of the time we compare models. So maybe two compartment is better clearly than one compartment. Okay, it was an improvement. But is it good? So what do you mean by good? You need to come up with a definition, criteria. So sometimes statistic, we compare likelihood, we compare objective function value, and we compare two models. But it is meaningless to say, okay, if you only look at one model, is it good or bad? Is it, yeah, you can look at diagnostic, DV versus IPRED, DV versus PRED, okay, some deviation. But ultimately, what are you using the model for? For example, are you trying to predict AUC and Cmax in patients and correlated with efficacy? If yes, maybe you should check how good is your model to predict AUCs and Cmax. Nobody cares about your like residual at say 100 hours after you took the dose. So you need to come up with a like criteria based on what you will be using the model for, and make some kind of compromise. So we are not in the business of developing perfect models. We really want something that help us and answer the clinical development question we are trying to apply to advance our drug development program. So yeah, we many time, and I believe that's like one of the tension and challenge with pharmacometrics is we most of the time we use a model that's good enough. It is very time consuming, very hard to develop these models. So we just want something that help us answer the question, because you can spend years developing models if you want to optimize every aspect of it, but we don't have this luxury. So yeah, we accept some deviation from the unity line because ultimately that's the best we could do given the timeline we had. Any other questions? Do we see hands or?
I've got a question. I put my hand up. Yeah, so my question is on the residual error that Mary had presented earlier on. So I just want to know the implication of say for instance, I get an example of a combined error. Now you've got like a sort of a higher value of an additive component. Like, what does that imply as far as the model diagnosis is concerned? Like, you've noted that there isn't any, like the VPC is fitting very well, and the individuated residues or condition weighted residues, they are all fitting well, except that the additive error part of the value, it's unusually higher, like close maybe to half of a Cmax. So what does that imply, like if you have such a situation?
Yeah, high residual variability means maybe you don't have a lot of data, or your data is really noisy. So on average, you can predict maybe your PK profile, but you can't simulate realistic data point with precision. So individual data point, it's very rare that we really want and interested to simulate individual points with error. So it will be good to look at your data and see why do we have this very high residual variability. And it's always easier to understand and grasp, say, to represent your additive error in terms of, okay, you said it's half of the Cmax. Is it like you are almost at 100%? So it's equal to your mean concentration? That's very high variability. So your data is very noisy, going up and down.
All right, thank you.
Yeah. So, Cassius, you still have your hand up?
Yes, Samir.
Yes.
Oh, yeah, I have a question, but this also includes the previous session that we had in the last two, was it last week? Yeah, I think the last 2 weeks of the population PK. So in our project, the MEV project, our PIs, they done a study of like a single ascending dose in a preclinical animal model with a fixed dose. So since it was a single ascending dose, so they used like a dose range of like 5 to 100 milligram, which translate to 50 folds variation. So my question is like, can this have like an influence on the estimating the PK parameters for population PK? Like, can the drug like changes the behavior from first order linear absorption to a zero order depending on the dose?
Yeah, absolutely. So basically, I'm still sharing my screen, right? Yeah. So some of drugs have what we call target-mediated drug disposition, especially when you have very large dose range. Can go from linear to nonlinear to linear. But yeah, given the very large dose range you are dealing with, nonlinearities can come up and show up. Of course, in the translational exercise, we want to understand what's going on. It's useful to have this large dose range. So you inform, okay, what dose range we will go forward in a human, and maybe later you will narrow down your dose range into linear region if you can, or regions that has like the desired efficacy. But yes, it's very common when you have very large dose ranges to encounter nonlinearities.
Okay. So, and then wouldn't this gonna affect the performance of the model? Like, let's say the structural model, because there will be high variation, like such as like errors on the, let's say, clearance because of this high variation.
Yeah, well, you will have to check what makes sense for your compound. More and more we have seen PMDD even for small molecule, depending on some special cases, more common in biologics and MABs. But yeah, nonlinearity depends, can happen. Can send you some references if that might help. But what you some of the diagnostic is to split your diagnostic plots by dose level. If you have enough data, so you see, okay, maybe you capture the median dose, but as you go higher or lower, things get biased. So that is a strong pointers that you need. Well, you can use those as a covariate, but it is like not very useful, especially when you want to extrapolate a new dose. You can, but when you have a more mechanistic type of model that incorporate nonlinearity, yeah, you can go up and higher in concentration and predict what might happen when you change your dose.
Oh, yeah, that makes sense. Thank you.
So yeah, one of the paper I highly recommend is Mats Carlson paper called Assumption Testing. Yeah, Carlson group has many paper on model diagnosis. So it's from RADA, but yeah, if we don't have it, I will make sure you have a copy. So basically, this paper tell you what to diagnose, and basically what I want to show you is that yeah, so if you do, so many software give you like out of the box all this diagnostic, super easy, click a button, but yeah, you should be able to do stuff when you need to. And yeah, if you have questions, keep going.
So Samir, this is Colin. I see quite a lot of hands up. But I'm just wondering if we should maybe take a little break. And then when we come back from the break, just start to hear from the fellows how this particular lesson applied to their own projects. And if there are any questions or thoughts that came to mind as they start to think about applying this, the learnings from this particular lesson on model evaluation, model diagnostics to their own work.
Sure, let us take 5 minutes? Okay. I will be back at 4:13. We'll have 5 minutes. All right. So we'll be back. So as Colin mentioned before we took the break, looking to hear from you how is there any blocker preventing you from applying the learning in your project? Is it maybe our difficulties or access or anything you are facing? Maybe statistical concept, etc. Would like to hear from you how you are applying or not being able to apply, so we fix it.
Samir, maybe I want to kick off with a question to Mary, and Mary, you can always just bounce it back out to everyone. But on the learning management platform, Amy had done a nice presentation and provided a set of slides on QSP models, quantitative systems pharmacology models. And these are models that tend to be multi-parameter, multiple differential equations, quite complex models. And the whole topic of qualifying those models is something that certainly bothers me. Now, I'm asking because, in your particular project, this might be relevant. So you want to make any comments on what you thought about that presentation by Amy, Mary?
I'm sorry, Amy is, I don't know if I saw that presentation, but I did a summary of, I think the first three, except the last one, because I was finding it hard to understand. So is Amy's presentation the last one?
Yeah, it's Amy Chung.
Maybe let me check it. I will get back to you.
Okay, I'm going to share my screen and I'm going to point you to the particular work that I'm talking about.
Okay.
I think is it this one? This is model development. I think this is the lesson before this, right?
Right.
Yeah, this is the lesson that you reviewed, right, Mary?
Yes.
Yeah, and the one that I'm asking about is, yeah, evaluate model from literature and awareness of qualification considerations for PBPK. And this should be QSP models, I think.
Oh yeah, I think this is the last part that I left out because I wasn't able to understand.
Okay, cool. Thank you. So maybe then just back to generally the whole topic of how all of what you learned today applies to your particular projects, to the whole team. Safa, your hand seems to be up.
Yeah. So actually, I tried some of the evaluation and validation tests like goodness of fits and VPCs to my project. So I will just give a glimpse about my project. So actually, it's a continuum from an APT fellows in APT 2023, Marwa and Noel. They developed a disease progression model and for Alzheimer's disease, and they use the amyloid accumulation to define the disease progression model. So I'm in the beginning, I'm starting like to reproduce what they did. Like I'm trying to. So in Marva's papers, she used 3 different models. One is linear, one is nonlinear, one is exponential as a structural model to define, like to see whether it fit the data set. She and I, and suggests that the exponential model is the one that fits the best, and that's based on the objective function value. So the use non-mem, in our case, we are trying to implement that on monoliths. So if I can share my screen, I have a slide.
Yeah, sure.
Okay. Because actually, I really want like the feedback and whether I'm doing things right or what's going on. So can you see my screen?
Yes.
Is it the full screen or the presentation?
We see two slides. Goodness of linear, nonlinear, exponential.
So now,
yeah.
Okay. So now you see one screen, right? Hello.
Yes, Safa. We only see one screen now.
Okay.
Yeah.
So actually, I tried using monoliths like to building the structural model there using the linear, nonlinear, and exponential. So she actually used it. She had the equations like that she used. So we referenced that, like we used the same thing. So first I actually check the objective function value just of the structural model without adding random effects for each one of them, and then add like random effect for each parameter. Like for we have in the linear and exponential, we have two, which is the base, like the baseline of the amyloid and the slope. So it's like the accumulation during time. So my question here, like as the beginning, so it's this is the way we compare between structural models. First to see the objective function value and add one at a time. So Innocent like suggested that to us, like to remove even the random effects and then add one at a time and see how it will develop. And after that, after like adding the random effects, so I just plot the VPCs for each one of them. So I just want to be sure that this is the way that that to look at the things, and what else we need to see. Like I try to see also the goodness of that plots, and as a combination of all of these, how can you decide that this is the best model? And also there is also a covariate effect also that will be included.
So what I see here is that your median is way off.
Yeah.
So well, first we need a model that at least get your median right. So I'm not sure why you are way off. For me, all these three models are not acceptable. They are not capable of presenting the median over time. And also, I would look, I don't know how sparse your data is. So I would look at individual profiles. So is it really linear or non-linear? Like how does, because these can be obscured when you look at thousands of patients together. Because we want our model to be really reflective of what's going on in particular patients, and we go population. So also, I'm not sure how you are using your baseline information. You are not using it. probably are estimating it. That's why we start
Yeah.
at the wrong level instead of using our baseline. That's one. Second, I'm not sure what do you mean by structural model. So structural, what is it? The linear, the nonlinear, or exponential? And it's impossible that all three have the same objective function value. Keep in mind in monoleaks, you need to evaluate your likelihood. You can't use whatever you get from a simple run. You need to ask for, give me my -2 log likelihood. So it run additional simulation to get your likelihood for a particular model. But here there's something wrong, in my opinion. It can be same log likelihood for all three linear, nonlinear, exponential. So now let us say you added omegas. Okay, your objective function value is expected to go down, but now your last model, something weird going on. It's like jumping. It's not in the same range. So maybe your model didn't converge. Maybe something wrong with the setting.
Yeah, because also, yeah, I found it like weird, like to have the same, like without running the model without any, without including any omegas. Like I have the same similar value. I thought like maybe I'm doing something wrong, or I need to do something on one of those. Yeah.
Yeah, we'll have to double check what's going on and why your median is way off.
But one of the things that you said, like, so actually, yeah, I said like for initial estimates, like is the auto like to make like the software make like the estimate, the initial estimate. So I'm doing that, but you said that it's better like to put or to add my estimate. I think it's part.
If you have your data or your Monolix model on SharePoint, I can try to have a look.
I'm sorry?
If you need input, just show me where is your data and model on SharePoint so we can have a look.
Samir, I noticed that Wheeler has got his hands up.
Yes, Wheeler?
Oh yes. Yeah, I was just trying to comment on Safa's model. Yeah, so I agree with you when you asked about how she handled the baseline data. So I just wanted to ask Safa if at all she did that in her model. So I've just shared a paper that talks about ways of handling like the baseline pharmacodynamic data. So I believe if you can maybe just read through, of course, there are about four methods there, I think, in that paper. I suggest that if you can just like read that and then try to define like your initial conditions for the pharmacodynamics, whatever parameters you're looking at, then just try to see if the model is going to sort of maybe improve, because I could see even from the VPCs like it seems maybe you're estimating the baseline, something like that, but not necessarily like put some sort of like a function that could define on how you're handling the baseline so that you can model the rest of the data. So that's what I wanted like to comment on. Thank you.
Yeah, thanks, Mila. Any others trying to apply the learning into your projects facing challenges?
Oh, just a question from me. If there's still an opportunity to access non-mem, and the reason I ask, well, Monolix is very, very good and very fast, but so with non-mem and when you're plotting the VPCs, it helps you to understand more what's happening. At least you know why you need simulated data, you know why you need observational data. But when you're for Monolix, if your aim is to get a plot, well, you'll get the VPC straight there and then. But if you really want to understand what's going on and understand why you need simulated data, why you need this, how to deal with the different bins, then I don't think Monolix is a great learning tool, in my opinion. So if there's an opportunity for
Well, yeah. So I don't know. Like you can redo the Monolix VPC in R. Nothing preventing you from doing it. So basically, let me show you. That's why we built tidy VPC. So basically, here I loaded. So here VPC results UI. Basically, you just need two things. You need the observed data, and you need the simulated data. We don't care whether it comes from non-mem, Monolix, you name it. It can come from anywhere. So once you have your observed data as simulated data, you load, say you tell it, because we don't only support non-mem or Monolix, you need to tell it what's the name of your time, concentration, blah, blah. I want automatic, maybe PAM binning. And so that's, let me make it interactive. So here you can see what's going on. You can zoom in. You can change the bidding. You want more bins. Let us say, I don't know. I want 12 bins for some weird reason. So now I have more bins. You can stratify. Say I want to stratify by study. So, and all this is just to help you, because what's really going on is it's just writing our code, which you get. So here it's 20 lines of code, not too much, as it's using tidy VPC. So, and a simple ggplot. So I'm not sure what's preventing you from, say, getting Monolix simulated table and observed table and exploring really in detail as you see fit.
No, thanks. So this is a case of where I had a thought about it. Once you told me I could use what simulated table from Monolix, my issue was catered for. So yeah, we'll try to replicate what Monolix does, just for the purposes of learning.
I'm not really into replicating what Monolix does, because Monolix is closed source software. While they advertise what's doing, there is no real, say, exactly, if you are using the auto binning of monoliths, exactly how it was done, I'm not sure. But here we allow you, say you want, so that's only one method of binning. We support all these methods. So you can even you can provide your own breaks. You can do whatever you want. Here you have much more flexibility using tidy VPC. But yeah, tidy VPC is not tied to any software. You can simulate in R even if you want. And I keep asking our IT guys on access to VDI and non-mem, but please don't, you have access to Phoenix NLME, RS NLME, and Monolix. So for now, I believe and then MixR2 if you want. So you have multiple options. For example, like one common use case that I still cannot be done in Monolix is when you have a crossover in time varying covariate. You have to write your own code or use tidy VPC, much easier to do this kind of VPCs. So you just bring in the simulation. In Monolix, it allows you to save the simulation after you've run it. You need to specifically ask for it. Once you do, you can bring it to R and do whatever you want.
Yeah, thanks.
So let me share my screen again while the others ask questions. I don't know. Basically, just to remind you, even those that don't have, say, data or project. So remember, we gave you this parse data set in the beginning. So nothing preventing you from testing. Say here, it's the first order model. So here, of course, like Phoenix give you most, if not all, graphic out of the box. You can use RS and LME. Here we have, say, let us say I don't know, I didn't try it. Let us try to run the VPC. But any other questions? But let us use this time for your own struggles and projects, if there is any. So I'm checking the list. I don't know. I saw Muhammad's hand up earlier, but now Muhammad is not. Did you
Yes.
have a special question? Yeah.
Yeah, but it was answered along the line, so that's why I had to bring down my hand.
Oh, okay, great.
Okay.
So
Thank you, Samir.
are you now in South Africa or still in Nigeria? What happened?
I'm in Cape Town now. I've been
Okay.
here. Yeah.
Okay. I see Cassius again and Ronald and Francis. So Francis is on top my list. And Francis, did you have a question?
Yes, Samir. I'm glad that we did the demonstration of the 30 VPC that I mentioned earlier on. So from the screen or the demonstration that we did, how do we judge the VPC from that demonstration? Do we get a score, or does it have to be shaded, or the observation has to be within the shaded area to say that, okay, this model fits our data very well, or it predicts our data very well? Like, because with monoliths, I think it makes life simpler, or even though like we don't know what's happening behind the code, but one can easily judge the performance of the model by seeing if there is a red shaded area. But yeah, I'm struggling to get the performance of the VPC in R, how one can judge the or penalize the model?
Yeah, well, the shaded area is just like a visual aid, but you can still see if the point is outside or not. So basically, I can share my screen again. Of course, if you like shaded areas, you can file a request to tidy VPC. But so basically here we see everything is within the limit. So we are good, not bad. You can go interactive and say, okay, I want to really zoom in what's going on here. Yeah, I'm really inside. Yeah, I'm inside. So so Monolix will give you very similar visuals. Just maybe here we don't have like, I don't know. Yeah, yeah, no, it's not outside. But
Oh.
yeah, it's just a visual aid. And many times we accept the models that has some reason outside of the limit because it's the best we could do. Again, you should not look at one model. You compare a list of models and you choose whatever is doing the best possible for your current exercise.
Oh, I see. So in case of the study A, like the Cmax of I saw that it excluded or underestimated the Cmax of a certain patient or the observation there. So can one accept this model in this case?
It is still within the range. We are over simulating a little bit, but not too much. So here, let me zoom again. So here we had simulated of 79, and then we had observed of 73. Like, I don't know. We need to see how relevant it is, but we're still within the limits, so I would not be bothered at all. We can't expect this line to be superposed all the time.
Thank you so much.
Who's next? Francis?
Yeah, thanks. Do you hear me?
Yes.
Yeah, so I'm not presenting a challenge, but rather an idea on how we will use the concepts in this week's lecture in our work. So just a very brief recap. We are going to evaluate the use of propensity scores within a Bayesian framework to improve how we generate inference on treatment effects. And our starting point is going to be to kind of fit an originally published model to the data set we're going to use in the context of colorectal cancer. So one of the first things we're going to do is to find out actually whether that model that is got from literature is able to predict the data that we have. And I think from what we've discussed today, that perfectly fits within the context of an external evaluation. And that will be sort of the first step before we go into maybe refining the model and improving it so that it fits better the data we have. And I know the number of techniques that probably we're going to have to explore, for example, some basic goodness of fits, but also looking at the VPCs at one point. The next thing that we want to do is to generate artificial data from a large clinical database. As we have a randomized control trial, we want to generate a subset of this trial which has imbalanced covariates. And we're going to have to do this bootstrapping approach so that we be able to create smaller data sets that have an imbalance in the covariates and use that as a way of starting off to test the hypothesis whether Bayesian propensity score adjustments can lead to actual an improvement in the way we produce the treatment effects. I know within the week's work, Bootstrap has been presented in the context of evaluating model stability, producing precision of parameter estimates without assuming normality. But we're going to use the same technique, but with a different motive. In this case, is to resample and generate newer data sets from this bigger pool. So yeah, I think it's a very relevant discussion that we've had this week. And once we've implemented it, and of course, if there are any challenges, we'll present it for assistance from the faculty here. So I just wanted to share that bit, how the relevance of this week's work is. Thank you.
Great, thanks. Any other comments?
Hello.
Yes, Ronald?
Yes, thank you, Samir. On the VPC, the one you're presenting and the one in the material, for the material, they actually quite different. Maybe I can, let's see if I can, I'm using my phone. I don't know if I can share with you what I did.
Sorry, Ronald, I had
So I was asked about the VP. Because what we have is like interactive. Is it just for RSNRME or just the IDVPC package? Because the one I'm using, the one we have in the material, it doesn't actually, when you come to binning, you have to create your own binning binning strategies, which sometimes gives a hard time. But this one can give you like automatic binning, show you where maybe put your bins at. So I was wondering, is it the same? Maybe my friend about the IDVP.
sorry, Ronald. Maybe it's my connection, but I have very hard time understanding or hearing you. If you can type your question, or any other person from faculty understood Ronald's
No,
question.
I didn't. I was trying to hear it as well. I think it would be best if Ronald typed it in.
I think what
Okay,
asking is, I think what is asking is if the IDVPC is interactive. Because what you are sharing is what is it's like it has a shiny a shiny app where you can interact with it instead of what.
Yes, clearly. Because the one I'm using, you actually you have to write everything from R, including binning strategies. But what you have has automatic binning. You just select what you select is interactive, like signing up. So I was asking, is it different from IDVPs we have, or RSNRME, or it's general?
No, I think there's an interactive app which you can use with IDVPC, but Samia can clarify on that. Let me try to get the link.
Whatever, the one I showed is called Certara VPC results. It's on GitHub, nothing special. It's part of certara.r. So we use it to rapidly explore VPC with IDVPC. I'm not sure I get what you want. You can write code or you can use a Shiny app.
Yeah, so he didn't know that there was a shiny app. He wasn't aware of Cetera VPC. I think that answers this question. Let me get the link for the Cetera VPC.
Yes, it's on our R school. It's all online, with all the lectures are online with the links to all the packages.
Okay.
Any other comments, questions? So while you, so for next time, you also have this project called the COVFX example. So basically here, what I show you, so that will be the next module, but basically I simulate. So I simulate from a model, come up with a model, and I bootstrap it. So you have an example of a bootstrap. Basically here, I run a bootstrap 1,000 replicate, and it give you, say, histograms of your parameter. And then that's what I use for the COVFX. So you can also have a look, basically. So you have a model with no covariate. You can head-to-head compare, say, this guy, this guy. You see that we correct the trends. And Safa was, maybe not just Safa, say, you want to compare these two models, maybe you are aware or not. So you can have, we have something called model comparer. It works for, so here you can run non-mem from inside Phoenix. It works for non-mem runs as well. But let me show you how it works for Phoenix models. So you tell it, okay, I want to compare this no covariate with covariate. And you tell it, say, what diagnostic you want head to head. Let us say CWS versus DV versus spread log. And I'm looking for, yeah, let us start with that. It's running. Sometimes it's sharing takes a lot. Okay, so now you have this head-to-head table, and you can add more models, head-to-head compare. And you can look as well at the parameters. Like here you have this model parameter, a second model, and so on and so forth. And if you have VPC, you can compare. So check if there is any other questions or comments. Okay, thanks Innocent for sharing, and Davis, the link to our school. Any comments from others that we didn't hear today? Noor has been quiet. Didn't hear your voice.
Hello.
Hello.
I'm listening to you.
Yeah, please, if you have any question or comment, I'm just checking the list of attendees here, I believe. And Davis, we didn't hear you. We just saw a link.
Oh yes, I'm here. The session has been quite informative. I was just struggling with a few concepts, but I think as we went on, things started to make sense. So yeah, that's why I was quiet and following quietly.
Okay. Great. See if Amira, Winnet, Colin have comments.
Samir, nothing else from my side.
Thanks.
maybe just to point out, I know we talked about the population modeling and everything now, but probably from the basics to obviously before starting any of that is to really know what your observed data looks like. So, I mean, the whole point is that your model should replicate what you see, in other words, the observed. So, if you can work out, first of all, by visualizing that, and then based on the type of model we need on that visual. So that's really the base of. I know that sounds easy, but it's taken me many years. Hopefully not for you as well. For that really to sink in. So it's you're going to get okay. Apologies.
Wayland, we have hard time cutting. Maybe your bandwidth is slow.
I'll type in, but yeah, thank you. I just put the video off, and hopefully that improves the sound.
Yeah, better. Yes, better. Yeah.
I was just going to say that I know we talked a lot about the modeling side, but just to remember that the basis of all of this is the observed data. So the model's always going to try to replicate the observed data. So start there, start how to visualize the raw data, and then from that you'll know what type of model you'll need, or what you need to try and replicate. I know that sounds very easy, but that's it's a concept that I hope you just carry on with and keep in mind all the time. Always see the raw data or observed data, and that's really what you're trying to replicate. That's it. Thanks, Amin.
No problem. So if there is no additional comment or question, I heard last time some of you have issues with R. If you still have like building your data set or organizing it, if you still have issues, please ask questions, ask for help. And if you face any challenge in applying the learning and understanding the concept, you can always send you more material or schedule an office hour to go through topics in more detail. So that's good.
Yeah, and one last thing to add on is that, so if probably everyone has access to SharePoint, so in case you need help like from Samir, it's best if your models and your data is on SharePoint. So keep periodically putting the data you have and your models on SharePoint, so that in case you need help, you just direct him where to find the data. Thank you.
Yeah, thanks, Innocence. It's very important, especially if you need a safe copy of whatever work you are doing. And that's how I collaborated with Innocent and the team during his project last year. So yeah. All right. So I will give you a few minutes back. Keep in touch, keep engaged, and let us know about your questions. But Sadiq had a raised hand. Let us take his question first. Sadiq?
Yeah, thank you, Samir. I just wanted to follow up on getting access to Certara's environment for our project, because we have almost close to finishing the EDA now. So it's time for us to start the PBPK on SimSip. So if there is any update on.
Yeah, I copied Kenta on some of this communication. I emailed SimSip on having a VDI, like a machine, not your own machine. But yeah, I'm awaiting some replies from SimSip and Surtara IT. When I have an update, I'll let you know.
Okay, thank you.
All right. So talk to you next week. Keep in touch and have a good rest of the day, afternoon, or evening. Take care. Bye now.
Bye, everybody.
Thank you. Bye.